Appreciate you all joining us on another episode of Insight Discussions. I'm joined by a wonderful panel of amazing people tonight with Josiah Boyd, Bethany Hampton, and Autumn Wright. This episode, we're going to be talking about mental health, including everything that comes along with the topic, from dealing with it personally, having family members and friends that may also be going through it, and different things that we would like to educate and inform people on so that they can be better educated and edify other people.
Hi, I'm Josiah Boyd. Live in South Carolina, Columbia, South Carolina. For activities, mostly, I just either draw or make beats. That's really it.
And Josiah, you got an MPC or you do it all on the computer?
I have both, actually, but I prefer to do it on the computer.
I'm really interested in getting an MPC soon. I gotta sit down with you, chop that up together.
Man, them things are, they're nice if you got the right system and stuff, but they're nice.
Hi. So yeah, I am a wedding photographer. I don't like this. We can't do this. Hold on. I'm very sorry.
Well, Autumn, here, one of my good friends since we were children. Autumn has a very highly esteemed and highly credible photography business. What kind of dog do you have, Autumn?
I have two pets. I don't think you'd call that many. But I have a 4-month-old golden doodle and a fairly large yellow cat.
Very skilled painter, photographer, and she has a nice dog.
I don't know about skilled painter, but thank you.
Oh,
I dabble.
I have the paintings hanging up in my house. So.
You mean the ones you stole?
We're gonna edit that out. Oh, she's also married to my best friend too. So shout out to your husband.
My name is Bethany. I'm from Alabama. I currently live in Minnesota. I'm in college for software engineering, and I kind of like the same hobbies as Autumn, like artsy, like photography and painting. So I don't really have a business anymore, but I still like it.
So you kind of discontinued your photography page?
Yeah, I just kind of do it like for personal fun now, not necessarily like I don't take on any clients really anymore at the moment anyway.
Okay. I like the aesthetic that you had, the very earthy kind of feel to your photography page that you had.
I know, I'm kind of obsessive about the flow of it, but yeah.
You get very hung up on which pictures you post?
Yes.
Okay.
I can relate to that.
Yeah.
So I wanted to start off with the first topic, but what specific health challenges have infected your life? So whether or not it's a parent or a sibling or a best friend or a mate that has suffered from mental illnesses and things of that nature, or if it's yourself. So what kind of challenges have affected your personal life? I want to start with Bethany.
So personal life, I was diagnosed with ADHD. So I kind of wanted to talk about that because that's kind of something that really does affect me. Like, I think people think of ADHD just as like, you get distracted pretty easily, which is true, but there's a lot more to it. Like, I don't know, like there's sensory issues and you deal with impulsivity, and then you like there's these stimulant things. Like right now I'm literally doing this. I don't know, it just kind of affects your whole day and your whole life actually.
Mm-hmm. And want to go to Josiah next?
I've had 2 experiences in my life that are kind of traumatic for me. The first one has to be me watching my grandfather die from cancer for like 4 months straight, back and forth to the hospital, just watching him slowly die. And then one day just walking in and just seeing him dead was a lot for me because I grew up without a father. He was my father figure. So that happened. And with my grandfather never finishing school, he died the same year I was graduating, and I wanted him to see me walk the stage. He didn't get to see me do that. Second one, traumatic for me, has to be when I've met my father for the first time. My mom told me the full story of my dad and how the thing that got me the most is how this man wanted to have me aborted. Didn't go through with it. But when I meet him for the first time, the first thing he wants to do is pretend like, oh, this is my son. I'm proud of who you are and what you've become.
Mm-hmm.
There's a lot more behind that story I can't go into details about, but those two of the first major ones. And the third one has to be my car wreck where I nearly died. That has a snowball of effects. Those main three.
So from those three experiences in your life, you would say that those are kind of those are the pushing events that led you into having the different mental health issues that you currently have.
Yeah, I can't get into bullying at school because that was
Mm-hmm.
bullying, but those main three that I mentioned, those are like the main ones that just drove me off.
I got you. And Autumn, would you like to share anything?
Yeah, I've been diagnosed since I was 14, I think, with clinical depression and generalized anxiety and ADHD. Gotta have all three. But yeah, what Bethany was saying a minute ago, like I feel like ADHD is kind of snoozed on a little bit because a lot of ADHD and anxiety actually go hand in hand, and a lot of people don't realize that, just how closely connected the two are.
Okay. And that's something that can definitely educate me some. I've talked to a couple of our friends that have ADHD, and it's one thing that just growing up, I can speak for Josiah myself, just growing up in like Black households, it's always, well, he probably just needs beaten. So he probably just has BA, not ADHD. So it was never a thing of, oh, he's hyper. He's just, especially with boys, oh, he's just bad. Most girls,
Yeah.
we didn't really see it much with girls having ADHD. She's kind of just energetic and lively, and it was kind of just pushed it aside. So that wasn't something that I was very educated on. So definitely, I hope that y'all could help us to have a better understanding of how that really affects people's lives, rather than just go ahead.
Sorry, I keep thinking you're done. Sorry.
If I'm talking, you all three of y'all can feel free to interrupt me. This is not like normal life where I'll just speak over you. So during this segment,
okay,
y'all can always feel free to interrupt me because I'm just the host. Y'all are the actual, guests that are knowledgeable and have something to offer. I'm just here to be here. Go ahead, Bethany.
I was just gonna say it's actually kind of interesting. ADHD does kind of present differently in women versus men. I don't know. So a lot of times I think women do get diagnosed less or misdiagnosed, just because of how it presents. I don't know.
Now, there was a couple of studies that I've done some research on lately that said that women are diagnosed and just handled differently when it comes to healthcare in general. Do you feel as though that's even worse when it comes to your mental health? Because the stigma that all women have is that, that women are emotional, that women exaggerate things, or that they are very sensitive to pain and things of that nature. Do you think that those stigmas affect when it comes to you talking to a doctor about your mental health, that they don't take you as seriously?
I definitely do. So I've personally seen it more with like physical health, where it's like if I'm in pain, it's more like, oh, it's just this or it's just this. But mental health, I could definitely see that too. Thankfully, I've had very understanding doctors. I don't know, maybe Autumn could speak more to that too.
I was about to say, like, I feel like it's more towards physical health than it would be for mental. I've had so many doctors be like, well, something's wrong with me, or this hurts. Like, if you have anxiety, right? Like, you just need therapy. And the amount of time that I have spent at doctor's appointments, and people are like, well, are you in therapy? Have you considered therapy? It's like, well, maybe you're doing the wrong thing. You can always go see a different doctor, and think it's just all in my head.
So for myself, I don't suffer from any kind of diagnosed mental health issues. There may be. I'm sure there's a lot of things wrong with me, but as far as I know of, that's not one of them that I've been told that there's something wrong with me on that note. But I will say that I've suffered from situational bouts with depression or anxiety. The worst experience that I can definitively say, there have been times of severe depression or suicidal thoughts and things of that nature, but the worst experience I can feel, even beyond just the feelings of depression or suicidal thoughts, was the feeling of having an anxiety attack. And I'm not 100% sure, because I don't suffer with it continuously like some of you that may be watching, or the two of you. so that I'll know definitively, but from what has been described to me, that's definitely how I would describe it. So the feeling of, I remember I was in my home by myself. There was nobody around, of course. I was living by myself, but everything felt like it was a lot smaller than what it was. I lived in a small home anyway. My home felt very, very tight and very claustrophobic. I was really, really hot, like for no reason whatsoever. I was really hot, really sweaty. For whatever reason, I felt like imminent death was just like you had to knock on my door. I didn't know why I felt very unsafe and my hands were shaky and kind of dizzy. And that's one of the only times I've ever felt that my heart was beating. I could feel my heart on my chest just beating really hard. Maybe giving like a public talk in front of the congregation, or not even getting married, did I feel my heart hit like that heavily. And afterwards, it kind of went away eventually. But afterwards, I said, man, I think that was a panic attack. Maybe like a couple of hours later, I said, man, I'm glad that I don't experience that continuously, because that was a very difficult situation that I was in. But for me, myself, I knew that, well, once I'm out of this situation that I'm in, I'll be perfectly okay, which I did recover and I was fine. But for those that do have anxiety all the time, what is an anxiety or panic attack like? How would you describe that to somebody else? Autumn.
I honestly, I feel like you described it pretty genuinely there. I think it catches you off guard. You can be alone, you can be in a crowd or in the middle of work, and then all of a sudden, I don't know. To me, it always feels like the light. Like I start getting tunnel vision, and your heart beats out of your chest. You get super clammy, and for whatever reason, you're just like, I'm dying. I'm dying, and why is this happening to me? What did I do? What did I take? And then your mind just starts running even more to what happened and what caused it, or at least for me, it does. It does, and I start wondering, what on earth did I do, and why am I about to die? But after so many years, I'm kind of like, okay, so you know what this is going on, you know what this is. You know, take a deep breath in. Nothing is keeping you from breathing. Nothing is physically wrong with you. Take a deep breath in, take a deep breath out. I breathe in for 4 seconds, out for 4 seconds, and I do that until the feeling's over.
And seeing other people deal with that, do you think that was really helpful for you, so that way you weren't so lost in the storm? Like, okay, that you kind of like were aware, okay, I know what's happening right now.
Yes, for sure.
Mm-hmm. And you mentioned earlier that your mom would show you different breathing techniques to help you. So practicing those for yourself helped you to maintain. Okay, Autumn, did I cut you off?
Yeah, you're good. I was just gonna say that it's so awkward when you start having these feelings in front of other people. It's so awkward, because you either have to cave and think and go ahead and panic, or you have to be like, just suck it up and just kind of sit down and hold on to a chair and be like, you can do this. You're gonna survive it.
So from your experiences, because some people are somewhat, how do I say, they're more so in denial, or they don't want to seek out help because, like Josiah mentioned, the guy is walking up and down the street. Or for myself, I grew up in cities and things like that. I've seen people just sitting on the bus, just talking to themselves, or just wrapped up in the coat. So that was my only understanding of what mental illnesses were. Other people, maybe family or friends and things like that on the block, it's just like, oh, he's just kind of different. It's like, okay, you kind of they're just different, quote unquote. But actual mental problems, I associated with crazy people, or just the term crazy. So some people do not want to seek out help. They don't want to seek out any kind of advice, or just saying that they have any kind of mental problems because of the stigma from growing up. Josiah, did you experience this with yourself, of not wanting to seek any kind of help, or just feeling negatively about yourself because of those other things? You're shaking your head, yeah.
Oh yeah. See, the thing about me was I was always told I just had an attitude issue. So I would take it with whenever I'd have a depressive episode. It's like, oh, you're just being a bad kid. You just have an attitude problem. So I didn't even seek help till I was about 25 years old. So it was just repeating cycle of Anytime a episode happens, it's like, oh, you're just being a bad guy. You just suck it up, keep moving. And it was up until about 2018 when I actually went and got help. But other than that, yeah, it was just the whole stigma of, yeah, you're a guy, get over it, man up, or just got an attitude issue, get over it.
So I'm assuming Autumn will be back eventually. So with that, you said when you were 18 is when you first sought help for it?
25.
When you were
25,
20,
26.
Okay, so
Yeah.
what age are you at now? Just speaking of the gap in between of you experiencing those things and actually seeking help.
I just turned 28.
Okay, so about 3 years or so.
Yeah, I started taking anxiety pills at 26. I remember that year because that was the same year that I tried to kill myself.
Mm-hmm.
And I ended up what happened was I was having a real bad breakdown, and family issues were popping up. So for me, anger was a big factor in me, and I ended up punching my stereo, injuring my hand.
Mm-hmm.
As I'm driving toward this bridge that I already had in mind that I was going to jump off of, my hand is like hurting very badly, and I can't even drive at this moment. So I just decided to pull into this hospital, Prisma, which is by my house, and I ended up staying there for the night.
Mm-hmm. So how after that day, what was your mindset as far as seeking help and you're taking care of yourself on that note? Did it happen quickly or did it take some time?
It happened quickly because I want to say after my wreck when I was 20, that's when I was like, I can't hide this depression. I can't hide how I feel. I can't fake a smile no more, because after that wreck, and I also got diagnosed with PTSD, I just stopped hiding it. So whenever my depression came, you would see it in my face. And I was like, I need to get help, but I don't know where to start, what to do. So when I had that experience and I got to the hospital, it was immediate. But the thing was, my therapist took it one thing at a time. So we started with my anxiety. Then we went to my anger issues. Then we went to my PTSD. Then we went to past traumas, how I can overcome that. And then as of last year, we just started with my depression and with the depression meds that I take now.
Mm-hmm. So you mentioned that I'll assume that I have free reign to mention since you already mentioned already. So so with your suicidal attempt, that happened before you were fully aware of your mental state and your mental needs. That was something before all that, correct?
Yeah.
So
a lot of people in my heart could tell. They would say, something's wrong, you should get help. I was like, I didn't want it because I'd always see pills and the side effects of like suicidal thoughts or suicidal tendencies. I was like, I don't want to deal with that. I'm fine. I can deal with it. Just let me. But as we found out, it was not that case.
Yeah. So, and for you, do you think it was more so of the feelings of being a man that you were just so like, you didn't want to, sometimes as men, we don't want to say that we have a problem or admit weakness because as men, we don't want to admit we have problems or seek help because that's a form of weakness. Do you think it was stemming from that, or do you think it was something else that made you not want to seek help?
It was mostly that. And there's a term that I keep hearing people call people with depression like the strong friend, which for me, I was considered the strong friend. I was considered the person that every young person looked up to, which that was a lot of pressure as well. But I didn't want to have them see me as a weak person mostly. I always try to help young people, but I just didn't want them to see me in that state. I wanted them to see me as somebody that they could talk to, somebody they can come to for anything at all. But I can't do that if I'm not in the right mind state. So I had to do what I had to do, which is get into that right mind state.
Gotcha. And that was, so just to carry that thought some more, that feeling of not wanting others to see you in that perceived weakened state, did that give you the feeling that they not be able to have as much confidence in you if they saw you going through that?
Yeah. The way that it feels whenever people see me in that state is they kind of keep distant from me. Even though it's not the case, they just figure, oh, he just needs a little space. which is, for me, everybody's different, but for me, it's like, if you see me in that state, don't give me space. I don't need space. I need you to help me to at least get out that mind. Help me feel like I'm loved. Help me see that I'm not in a room full of people and I'm still alone. Help me somehow to feel grounded in a way.
Yeah. Why do you think it is that people may behave that way? Do you think it's that they're thinking, well, I don't want to intrude or to make them feel any more uncomfortable? Or do you think it's that, well, everybody kind of needs space to kind of get their thoughts in order? Which one do you think it may be more of?
I think everybody just needs space. But I think also if you ask that person, well, you don't have to intrude every time, but you notice, like, hey, I see is everything okay? They say, yeah. I mean, yeah, sometimes they could be lying, which was me. I lied about it. But, you at least say, well, I am here if you need something. And then you go about your business. But other than that, yeah, I think it was just they don't want to intrude, which for someone like me, intrude, please do it, because I can't do it.
So with that, let's say for myself, maybe I can speak for those that don't suffer from clinical problems such as this. So for people such as myself that don't suffer from depression long term, would it be best when, like, let's for yourself? And I know for me, I'm a liar. I will say, nah, there's nothing wrong with me. I'm good. And I'll just kind of suck it up and just kind of deal with it on my own, with just life in general. So in that note, I can relate to that. So would it be best when someone comes to someone that they know that they have a friend or a family member that's going through mental health problems, depression, anxiety, and such, ADHD, all these different things, would it be best after they lie and you know that they're lying, is it better to just say, okay, you know what? I'm just going to kind of just be here. I'm going to continue to text you or continue to talk to you and call you. Maybe not continuing to ask them about, hey, why are you so sad? I know you're sad. You're lying to me. Is it better to be more upfront and I don't want to say confrontational, but to attack it head on? Or is it better to go about a different way and just, or is it still better just to wait for them to approach you about the matter? Do you feel what I'm saying?
Yeah. Honestly, I think it might depend on that person, to be honest with you. Because like I said, everybody's different. My biggest thing was, if you see me in that state, blow up my phone, because I don't want to be alone. Let me know, because I don't feel loved at all right now. I'm very much in a vulnerable state. I don't even like being in this state. Somebody help me, because for me, it's almost like, in general, it's like drowning in a way and throwing your hands up out the water for somebody to grab your hand, being around a whole bunch of people and nobody grabs your hand. And it's a bad feeling. So it's like, if you see me throwing my hand up, somebody please grab that hand. Even if it's just pulling my head up just to be out the water, just that little bit can help me to be able to do the rest.
Gotcha.
Yeah, I'll be honest. For me, like I won't ask for help. I won't. I've always viewed myself as a problem for everybody else and too much trouble. So I won't. I've had people force me into getting help, and they just kind of stayed. They just show up and they stay. That's they just they're just there. That I haven't asked for help. I think that's probably one of my biggest problems in the past, is that I didn't, and why I got into a similar mindset as Josiah. But I think when it comes to what you were talking about in regards to how people should act or if they should ask, I wouldn't even ask if you're okay or not. I'd just be like, hey, I'm thinking about you, like I miss you, or whatever that is. Don't even prompt the question, are you okay? Because we're probably not going to tell you what's on our mind.
I got you. Oh, I was wondering, like, what is that? Like, it sounded like a slither. I forgot that it was a cat. I was like, what is that noise?
I'm very sorry.
No, it was only bothering me because I didn't know what it was. If I hear something, I was like, what is that noise? Okay.
See, my cat and my dog are chasing each other around the living room right now.
Oh, okay. They're going around the couch?
Yeah, and that's what's happening.
Oh, okay.
I'm sorry.
You're good. I don't know if anybody else heard it. I was just like, man, like, it was like something in the back of my mouth. What is that? And on that note, we're going to wrap up this episode of Insight Discussions. My name is Zaire Dennis, and I really appreciate you all coming by to check us out. And I really, really appreciate my wonderful guests, Autumn, Josiah, and Bethany, for sharing their stories and their experiences. We have soon part 2 coming, and here are some clips from that episode. See you soon. Explain to anyone that's watching, to the best that you can, what it's like to have your condition or to care for someone that does have the condition.
I live in a constant, I'm just going to be honest, I live in a very constant fear of pretty much everything. And I don't ever feel like I'm good enough for anything or anybody. I don't want anybody or anything. I don't want anyone to know anything about me. I'm terrified that people aren't going to like me, that, you know, I'm not good enough for anyone. And to have a conversation one-on-one with someone, I'm great. I can open up, I can be myself, but put me in a room full of people and I'm petrified.
Yeah, I definitely think, you know, different people struggle with different things regarding ADHD. But for me, especially if I'm unmedicated on a certain day, my memory can be quite bad. And I even with medication, I do lose things a lot and misplace things a lot.
It's sad, really. It's just sad every day. And I can at least attest, before I start taking my antidepressants, every day was like the same cycle. I wake up sad, I brush my teeth sad, I go to work sad. Lunch I'll be happy because I'm not working, and then I come home sad, I get in my bed sad, and it's just a repeat cycle afterward.